A nuclear detonation differs from other mass casualty incidents in two ways. First, the very high number of affected individuals. And second, the release of ionizing radiation, which has devastating effects on human health and spreads distant areas from the nuclear detonation. The first 4 days after a nuclear detonation is critical. The mortality from nuclear detonation is combination of synergistic effect from radiation and traumatic injury or cutaneous thermal and/or radiation burns. In case of 10 kiloton nuclear detonation. For comparison, Hiroshima nuclear bomb was 15 kiloton. Severe shockwave damage could extend to about a half mile. Severe thermal damage would extend about a mile. Flying debris could extend up to a few miles. Glass breakage and traffic crashes expands beyond 2 miles. Initial nuclear radiation is lethal for unprotected human within about 3/4 mile. Radioactive fallout occurs in an irregular elliptical pattern in the direction the wind blows. Lethal radiation could extend up to 6 miles. Elongated fallout areas can have potential radiation injuries, out of 20 miles away. Around 33 kilometers. People are several miles away from detonation still can get radiation injury but not other kind injury. Acute radiation syndrome, ARS, develops if person exposed to greater than 2 gray units of radiation. 1 gray causes mild symptoms. Acute radiation syndrome primarily involves the several organ systems: hematologic, gastrointestinal, cutaneous, and cardiovascular/central nervous systems. Nausea, vomiting, diarrhea, fatigue, and, at higher doses, autonomic instability and even loss of consciousness. Peripheral blood cytopenias can develop at doses as low as 1 gray. At doses greater than 8 to 10 gray, death resulting from cardiovascular/central nervous system. Supportive care includes administration of fluids, blood products, antibiotics, and in some cases parenteral nutrition. Or heroic support, defined as comprehensive, individualized care up to and including cytokines and hematopoietic stem cell transplantation. In addition, the management of combined injuries, both surgical and non-surgical, is an essential component of supportive care. Recommended approaches for antibiotic and myeloid cytokine use, for both prophylaxis and treatment, after radiation exposure largely follow algorithms for the treatment of chemotherapy-associated neutropenia. Approximately 10 liters of fluid daily and extensive transfusion support is recommended. Myeloid cytokines enhance neutrophil recovery in patients with neutropenia. Ideally, myeloid cytokines should initiate a treatment within approximately 24 hours after exposure. If radiation irreversible damages bone marrow, hematopoietic stem cell transplantation can restore hematopoietic function. And lastly, do I need to take potassium iodide, key, if there is a nuclear blast? Local emergency management officials will tell people when to take potassium iodide. If radioactive iodine is not present in radiation, then taking key will not protect people. If radioactive iodine is present, then taking key will help protect a person's thyroid gland from the radioactive iodine. Taking key will not protect people from other radioactive substances that may be present along with the radioactive iodine.